All right, Dr. Shashank Joshi, the member of the Maharashtra COVID-19 task force, is with us on the show. Epidemiologist Dr. Chandrakant Lahariya also with us on the show. Welcome to both of you. Dr. Joshi, let me start with your opening comments on what we've been seeing over the last few days. In fact, since we spoke last, and Maharashtra, once again, with the most number of cases, perhaps because a lot of international flights coming into Mumbai city. Is there now a cause of concern? Are you seeing an increase in positivity rates in some districts in the state?
I think the current testing has been upped and the test positivity rate has remained the same. Current Omicron cases are sporadic in nature and travel related. Clearly, this is anticipated and expected. So I don't see a major cause of concern. At the same time, we can't be careless and reckless. We need to appropriate our behavior in terms of both the Delta strain as well as the Omicron strain. My current worry is that the Delta strain is in circulation, and in places like Mumbai and some other geographies of Maharashtra or some parts of India, it has almost become endemic. Every day Mumbai is consistently reporting between 150 to 250 cases per day. And therefore that number has not dramatically gone up. At the same time, we are seeing that we want to continue educational and economic activities. And there is wedding season around the corner, festive season around the corner, a lot of travel there, a lot of crowds and congregations. So abundant caution needs to be exercised. And we need to ensure that there are no cluster outbreaks, either of the Delta derivatives, which are currently prevalent as the virus in circulation across India, including Maharashtra, as well as we need to ensure that we do a very tight primary and secondary contact tracing of all the Omicron related relevant cases. I think that is happening in top order. And I think, therefore, we need to be vigilant, we need to be cautious, but there is no alarm or panic to be generated. But of course, because what is the rapidity of spread of the Omicron, particularly what has happened in UK, Norway, and Denmark, we need to be definitely on the vigil. And I don't think we can let our guard down at all.
So, another important point that Dr. Paul made, and he said during the conference, he talked about the spread in the United Kingdom and said that if there is a similar outbreak in India, then giving our population, we could go up as much as 14 lakh cases a day. Dr. Lahariya, I want to understand, one very basic thing. Right now, the word on the street, so to speak, is that Omicron spreads very rapidly, but it is mild in the sense it does not cause severe disease. So if we were to now have a large number of cases coming in, because it's also showing vaccine breakthrough, will it still not be as bad as a Delta second wave because it seems to be milder? Can we at least bank on that?
So what we need to remember that in epidemiology or epidemics and pandemic, there is something called epidemiological triad, which essentially means that how a disease will unfold depends upon interaction of agent, which is the virus or its variant, host, the human behavior, and external factor and environment. So the context matter a lot in pandemics and epidemics. 21 months into the pandemic, each of the country has behaved in very, very differently. Like, for example, India had a severe wave. It had a wave, Delta wave far before, and many other countries are facing. So India's situation is very different from any other country's situation. And that's what we should be paying attention to. And that's why our intervention should also be different. Now, what we know with the reasonable confidence, not overconfidence, that by end of June, 67.6% of India's population had antibody, which essentially means they were exposed to the virus, and which was Delta variant. And then since then, vaccination has gone up. So putting those two things together, including the children have already developed antibody because they were exposed slightly lower rate than the adults, but still exposed. So India's setting is very different. And that's why even the Sutra model, which is the government of India and other experts working on this model, have said that while there might be increase in the cases, COVID-19 cases, either due to any variant or including Delta, but that the worst case scenario projected by them is 150,000 daily new cases. And if 150,000 cases, which is still higher, but definitely lower than the second wave. So what experts broadly agree that there is every possibility that cases might rise. We really do not know. But what is for sure that the extent would not be similar to what we had seen in the second wave. We also know because it's a milder, so while infection might be rising, but we can be reasonably assured that the hospitalization will not be that high. So it might not be overburdened. The ICU requirement will be low. So we should be like prepared for worst case scenario. But from public perspective, we need not to panic, and we should be just keep following COVID appropriate behavior. So I am not that much concerned immediately. However, this is something which, as information emerge, we should be recalibrating our approach and interventions.
Yeah. So, Dr. Lahariya, is it fair to say that over the next couple of months, we should brace for higher cases every day? It's likely to happen, but it does not necessarily mean that our hospitals and our ICUs will be overwhelmed. Is that the correct reading?
I would not say that either. The reason is that India is reporting around 5,000 to 10,000 daily new COVID-19 cases, essentially number of infections is far greater, because we know that the number of infections are usually the kind of infection which India is picking. Out of every 20 or out of every 30 cases, just one in COVID-19 case is being picked up. So when India is reporting around 7 to 10,000 cases, essentially infections are far more. So what we know that once the apprehensions or emergence of Omicron is reported, people might volunteer to get themselves tested, and that way we might detect more cases. Similarly, if government increase testing, that might result in detection of more cases, but I would not say that we can expect increase in the Omicron cases or COVID-19 cases due to any variant in coming period. We need to carefully watch the situation. If there is some increase in some particular setting, then only we would follow. But I don't see any reason as of now to see an immediate increase in the cases, any setting. And this is something which may change in 10 days, but as of now, no. And I don't foresee that in coming few weeks, unless there is a drastic emergence of Omicron, we would see any difference. So this might continue. The current reporting rate might continue for some more time or maybe longer.
Dr. Joshi, what is sort of the policy measure that needs to be taken now? Because testing rates have also come down with the low number of cases, as the sense of panic has eased, as the sense of fear and anxiety has eased. The amount of testing that people are voluntarily doing has come down. Do you think we need to ramp up testing levels right now, and do you foresee any case of some sort of restrictions?
I think a couple of things are very clear. Number one is that, we should forget our rebellious and revengeful mindset, and we should continue behaving responsibly and appropriately, not recklessly. We have wedding season and festive season around the corner, a lot of travel around the corner. So all we need to do is ensure that it's an airborne virus. It is winter time, so there is viral transmission and flu pandemic also around. So clearly what we need to do is ensure that when you suspect somebody with a flu-like illness, get a COVID test done. That is very crucial and critical, and that is mandatory. And we need to focus on increased testing. There is no two ways about that also. But at the same time, we need to follow the test positivity rate. The test positivity rate is not, the doubling time is not alarming. There is no need to get alarmed. Just don't follow numbers. Follow the rates, follow the doubling time, and look at clusters. Is there a cluster outbreak in any geography? Identify that cluster and then contain that cluster. That is going to be the key. So I think this will need a close, vigilant follow-up. I don't see any major deviation occurring in the current delta is on the decline. And the only appeal to everybody is that in the next 2 to 4 weeks, behave responsibly, ensure that you are masked. We need to continue and live with COVID. At the same time, we ensure that we have a 15% of India which is unvaccinated without a single dose. Ensure that they get their dose. We have 45% of India who have not received their second dose. Ensure that they get their second dose rather than clamoring with a panic for an extra dose. This is far more important. And protect the comorbids, protect our elderly, and protect our vulnerable groups. So I think unless and until it is mandatory, they may be protected better, where unless and until essential, they may not go out or venture out in crowded environments. Otherwise, I feel there should not be any major cause of panic, because Delta is clearly on the decline and we have Delta immunity in place. Only Omicron may disrupt it. We also know one thing, Tamanna, that origin of Delta was in India. And the origin of Omicron is in South Africa, which originally had a beta strain from the ancestral strain. From beta, it got overtaken by Delta, and from Delta, Omicron took over. We don't know how in the Indian terrain, how the displacement of Delta or Delta derivatives, which are currently being genomically tested, Omicron will replace it. Right now, there has been all sporadic reportage of Omicron, except for a cluster which happened in an office in Mumbai with Omicron with 7 cases.
Yeah.
Except that, and that is a cause of concern. See, our offices are open, our schools are open. A closed door environment where there's an air conditioner on, we need to ensure there are exhaust fans, there are HEPA filters, there is masking. And whenever you're eating, you need to ensure that you have an appropriate distance, there is air in circulation, and there is no transmission. And if you're having the slightest symptom, it is COVID time. Don't dismiss it as flu. Go and get tested. There's nothing wrong in getting tested. Isolate yourself, protect your family, protect your friends, and protect your country, protect the world. So I think it is simple. I think we just need to be back on the drawing board. We need to be vigilant without a panic. We need to ensure that we do appropriate behavior. I know it's fatigue because there's a lot of tiredness. But I think at the same time, we have to continue our economic and educational wheels. And we need to ensure appropriate behavior during these times.
Yep, absolutely. Especially, keeping back the focus on the basics, which is if you are not feeling well, if you have flu-like symptoms, don't brush them off. Isolate, test. There's really no harm in doing that. Thank you so much, Dr. Lahariya, Dr. Joshi, for joining us today on this important story as we continue to track it.